Your research shows that 2/3 of parents don't have a strong support network. The survey by Gidget Foundation also found that the majority of Australian parents didn't feel supported by all of their healthcare providers in the early parenting journey. Here's Arabella Gibson, who's CEO from Gidget Foundation Australia, which provides specialist counselling services for new parents. Arabella, welcome. So how important are support networks when people become parents?
Look, we know that 1 in 5 new mums and 1 in 10 new dads will experience perinatal depression and anxiety. And around 50% of parents will experience adjustment disorders during that perinatal period from conception through to 1 year postpartum. So Perinatal Mental Health Week, which is this week, has been designed to ensure that people can uncover their village and they can find people and networks and support there for them to help them on their journey.
So being a new parent can be isolating. It's often hard to get out. You're exhausted. Do you think the legacy of COVID and lockdowns is playing a role here?
Yeah, absolutely. We know that throughout COVID, people did feel incredibly isolated. Certainly people were giving birth without their partners. They didn't have friends and family able to visit them in those first weeks, months, and so on, and they really didn't have the opportunity for things like mothers groups and fathers groups. And so that's why we've got 56 organisations together to unite, to share a voice and to ensure that people understand what perinatal mental ill health is and how they can go about accessing those supports, because we know that there are many isolated people out there, different groups like regional, rural and remote communities, First Nations groups, cultural and linguistically diverse groups, and also our rainbow families as well. So finding access to the supports that can really help is absolutely critical.
What about this finding, Arabella, that the majority of Australian parents say they don't feel supported by healthcare providers when they become parents? What does that tell us?
Look, it tells us that we need to do better. It tells us that we need to ensure that people feel comfortable to start talking, to start sharing how they're feeling. And whether that be with friends or family or with their GP or with their child and family health nurse, midwife, it's absolutely critical that they do reach out to those services if they're feeling unwell. And particularly, you know, if you are feeling unwell for 2 weeks or more and things are not feeling as normal as they could for you, then to seek out a GP and get a referral with a mental health care plan to the Gidget Foundation, where you can actually receive 10 free clinical psychological sessions with a perinatal mental health specialist.
Arabella Gibson, good to talk to you. Thank you so much.
Thanks, Roz.